It's my distinct pleasure today to be able to talk with Reid Berger. For most of you, he doesn't need any introduction, but for those of you who don't know, Reid has been providing care at Western Wisconsin Health and formerly Baldwin Area Medical Center for 45 years. He's one of the most trusted voices in this community, and so it's just a great pleasure to be able to discuss the COVID-19 pandemic and vaccine with him today. Thank you so much for being with us, Reid.
Thank you, Dr. Findlay. I appreciate it.
So one of the most common concerns that we hear about the COVID-19 vaccine is that it was developed too fast. What are your thoughts on this?
Well, I think when you actually research the mRNA vaccines, you'll find that they've been in development for 10 to 15 years. And so this is not a new concept amongst the virologists and immunologists in the world, not just in the United States. I think in Hungary there was a developed vaccine probably 15 years ago. United States probably 10 years ago. And actually the mRNA research went on to develop vaccines for rabies, for cytomegalovirus, which is another viral infection, for influenza, and they worked on developing vaccines for HIV, but never HIV as a viral etiology never is stable long enough to really develop a vaccine for it. But the other 3 or 4 that they did develop mRNA vaccines for never went on to human trial, but had animal studies. And in the case of rabies, there were 2 good rabies vaccines available. And so there was no need to even pursue that any further. CMV was, cytomegalovirus was also abandoned, but promising as a potential vaccine. And influenza, we have a good influenza vaccine now that is widespread and easily available and well tolerated and easy to administer. Although the influenza vaccine we currently receive is probably only 60% effective. And it's a little bit behind what the mRNA vaccine anticipated effectiveness is going to be at 90 plus 94, 95%. So I think that the vaccine was not turned out as fast as people think. It wasn't a matter of somebody turning on a light switch last January and saying, man, we got to make this vaccine. This vaccine had been in the works, and very smart people were waiting for opportunities like this to develop a mass quantity vaccine that is effective and presumably safe. Now, I have to stress, though, that this was granted emergency use as a vaccine, and that is not the actual vetting period that vaccine would normally take place. But in this scenario with a pandemic worldwide, it's felt to be a prudent way to proceed, and a way that a vaccine could be manufactured without using live components, such as what we do with influenza vaccine, for instance. And so that this does not, the COVID-19 vaccine, ours, or SARS vaccine, does not contain live vaccine. This is not attenuated vaccine. This is not a dead virus. This is a mRNA vaccine that affects the protein. And you've all seen the little Sputnik COVID vaccine or COVID molecule. And those little spikes, one of these little spikes is what the vaccine attaches to. and builds an immunity through an intricate mechanism. It does not penetrate into our cell, and it does not affect our DNA. And that's a very important point to stress, is that this does not affect our DNA. So it's been a process for 10 or 15 years. It was developed then rapidly in the United States and worldwide for specifically this pandemic, COVID-19.
Thank you. That's a really good historical overview that we often miss, I think, in talking about this. And also you point out some really important details, like the fact that this is not a live vaccine, so it cannot cause people to get COVID-19 infections. And that's something that we continue to hear concerns about, and rightfully so, because we do know of other vaccines that do have live components. And so I appreciate you bringing up that point, and also that it does not interact with our DNA. It's a point of concern for a lot of people. So in light
and that's what excuse me.
Go ahead.
That's what I hear. That's what I hear a lot from people that text me or send me emails. Is what does this do to my DNA? Mm-hmm. And it truly does nothing for our underlying DNA.
Excellent. So who do you recommend the vaccine for at this point?
Well, I think that we've identified the populations that are most affected, and that's our elderly, long-term care facilities, our healthcare providers that are on the front lines, healthcare providers that are, even in the background in clinics, etc. I think are prime candidates for vaccine. People with comorbid conditions, i.e. heart disease, diabetes, are good candidates that are over 65 or 64, I think it is. Individuals that are generally unhealthy, with maybe immune system compromise or are immunocompromised, would be a good candidate. And I think then the general population, as this vaccine becomes more readily available, will be vaccinated down the road at some point in the future, and I'm not sure when that's going to happen. But I do think the rollout in our area, St. Croix County, has been well managed, and we had 30 plus firefighters receive the Pfizer vaccine through the public health service in Richmond. A few trickled into WWH for their vaccines, and myself and my wife received ours, both doses, and it was a blessing, and both of us well tolerated it well. So I think that in my mind, it's now for the long-term care. We have to get those individuals vaccinated, healthcare professionals, police, fire, EMS, and people with multiple illnesses, comorbid conditions. We call them diabetes, heart disease, COPD, lung disease, asthma, although asthma may not be as bad as some underlying individuals with COPD, because asthma might actually assume a more normal lung during periods of non-infection or non-asthmatic flares.
So, with talk about the vaccine rollout, and I've seen on the news, that they're hoping to have it available to the general public in as early as April. What would you say to people who are thinking about waiting? You know, they're kind of considering waiting to see how the rest of the community fares with it, or those first phases fare. What is your recommendation to those folks?
So I think if you have the opportunity to receive the vaccine and you're so inclined, you should do it ASAP. Just get it done. If you're patiently waiting and it's not your time, I think you have no real choice. But if it's open to the general public in a month, I think that you should receive the vaccine. Personal opinion.
Okay, thank you. That's I think a question that a lot of people have and want to hear your opinion on as a trusted provider in this community. Did you have any other comments about the COVID-19 vaccine or the COVID-19 pandemic that you wanted to share with the community?
Well, I just think I would like the people that hear this to, I mean, if you're my patient, to imagine what we would be talking about in the exam room, and it would be same conversation. And you've trusted all of us and all of your providers to make and help you make decisions that sometimes have been much more critical than whether you should get a COVID vaccine or not. You know, 3-vessel heart disease, mass in your lung, et cetera, and we've coached each of you through that, and the providers that you see do. And I think you should listen, hopefully, to your provider. Avoid some of the webinars and the negative YouTube videos that might be one or two or a small group of providers that are saying that this is not a good choice. You have to go with what science and science in general is saying, that this is a good choice. I think we believe it's a good choice at WWH, and I think surrounding providers that I know elsewhere have all tried to get this vaccine on board themselves. So I think that that's what you have to look at into the future. And if you can have the vaccine as soon as possible, I'd advise that you get it. It does not give you an out of jail pass as far as social distancing, as far as masks, as far as hand washing, but it is a move in the right direction. And I think that that's probably the key here, is it's a move in the right direction.
Well, thank you so much. Again, we really appreciate hearing your voice on this topic. I know your patients will appreciate hearing it, as well as your colleagues and everybody here at Western Wisconsin Health who has so much respect for the work that you do. And so we really appreciate you joining us on this topic, and thank you for your time.
Thank you, Dr. Findlay. Appreciate it.